Plastic surgery isn't as taboo as it used to be, and we're talking about the most popular procedures for this year. With me today is Dr. Daniel Ward. Hi, how are you?
Great to be back.
I love it that it's not as taboo anymore, because it used to be everybody would go do things in secret. They'd have to hide out. Now people are talking about it. We're publicizing it on social media.
Right. It's such a relieving change that people are just less worried about other people knowing. It's kind of like, I really think it's part of kind of a self-care element, like where people are doing this not for like a relationship or a job, they're doing it for themselves.
Yeah.
And it's kind of just refreshing, and they just don't care if other people know.
So let's talk about plastic surgery in general. You're a facial plastic surgeon. What are some of the most popular procedures you're seeing?
So within the facial plastic surgery realm, rhinoplasty, nose job, is by far the most common.
Okay.
And that's a common procedure because people really want their kind of true identity, the face that they see in the mirror, that they want to see in the mirror, kind of shine through, or in their selfies. And so they want their eyes to shine through, they want their smile to shine through, and the nose is just one part that maybe detracts from that. Another really common one is eyelids, just getting rid of the excess eyelid skin, maybe it's taking the tired looking eyes.
Yeah.
It's another great procedure because it doesn't totally change how you look or transform how you look, but it just makes you look a little bit more refreshed, simple, rejuvenated. And that's kind of what we look for. Other procedures, things like facelift, things like neck lift, which interestingly, you might find interesting, that there has been an increase in the number of facelift procedures being performed, as well as younger patients are now choosing to go with that.
I can see it, yeah.
Which I think is interesting because a lot of it is related to the fact that a lot of younger patients have tried non-surgical treatments.
I was just thinking that, yep.
Things like filler, things like Botox, things like lasers, which are great procedures. We offer them all the time. But sometimes like the cost, the recovery for these non-surgical procedures is actually not as bad as the surgical recovery.
Right.
I'm sorry, let me rephrase. It's worse than the surgical recovery, and the results aren't as good. So people are like, well, why don't I just do the surgical procedure and get it taken care of?
Well, and it's something that you get to that point where it's like, okay, let's get it fixed, and let's get it fixed for good or for a substantial amount of time.
Right.
And once you start doing things to your face, you do become a little bit more comfortable with possibly going under the knife. So when it comes to people that are maybe contemplating getting into this, would you suggest that, hey, if you're nervous to do anything, maybe try going the non-surgical route first?
I think it really depends on the person, because there's some people that just, if they try the non-surgical route, it's just going to be a waste of their time and money.
Okay.
So I'd say, I think you need to consult with somebody who's going to give you some good advice and present you with options.
Yeah.
I think that our job really as surgeons should be to present our patients with options so they can kind of pick which is best for them, because everything has a pro, everything has a con.
Right.
Like, what is the set of pros and cons that best appeals to you? And then also, when you're talking to people, you need to find somebody who you're going to partner with. I think that finding a surgeon, and I kind of view it this way with my patients, is that I am really trying to partner with them, and I don't really want to take them on as a patient if I don't think it's going to be a good partnership where we're working together kind of to accomplish their goals.
Yeah, absolutely. Well, you've even talked about things in the past, you can do a non-surgical nose job, but for some people it wouldn't work. That's where consulting with a professional really, really helps.
For sure. Making sure that you're seeing someone who's going to give you those different options. And there's a lot of providers out there who maybe don't know all the options, or they're just, like the old saying, if you're a hammer, everything looks like a nail. If you're a surgeon, it's important that everything doesn't look like a surgery. And if you're an injector, a nurse injector, whatever, that everything doesn't look like an injectable thing. Because sometimes, just because somebody can do an injection, say for the nose or whatever, doesn't mean that's the right thing for you.
Absolutely. And you're really good at saying, hey, let's not go too far with some of these things. You always really like to say that you're not trying to change the way the person looks, but to enhance or make them feel better about it.
Right. I really think that facial plastic surgery is about kind of helping people find their true identity. When we look in the mirror, when we look at pictures of ourselves, we expect to see a certain face looking back. And if there's something there that we don't like or that distracts from us, that's the thing that bothers us. And so it's really trying to enhance that natural beauty that's important.
Absolutely. Dr. Ward, as always, thank you so much.
Thanks for having me.